Hello, good evening. Um, Hi, this is me, Noshin. Just a brief introduction for the people who are joining new. I'm Noshin. I have completed MBBS from Rajshahi Medical College in 2015, and I've completed Mrcs in 2018. And currently, I'm working in Bedford Hospital in United Kingdom as a clinical fellow in General Surgery Department. Um, so, yep, welcome to you all. I'll just keep this conversation in English because I got a lot of text from students from Nepal, India, Pakistan. So I'll just keep it in English for them. But if you feel like you need me to translate anything in Bengali, you can write in the comment section. I'm happy to translate. It's fine. So. Yeah, hi all. Welcome to this live session. We have arranged this session to answer your questions about Mrcs career pathway. Before and after Mrcs, what you should do, what's the steps, step by step. So I think that especially for the students who are currently in third year, fourth year, so it's a good time to start because you can still work on your portfolio. It's something we didn't know when we started. All we had on the top of our head is we need to pass Mrcs, we need to go to UK, we need to get a job. But after coming here, you will realize that the main thing you need is a very strong portfolio. So I think the student life is the best time to start working on the portfolio, because then you don't have to work, you have a lot of leisure time to work on your interested subject. So yeah, that I will come later, but as in today's topic is mostly Mrcs, so I need to start from the beginning. So don't worry, we will be making more videos, and we will be telling exactly in which format you should like build up your portfolio and how do you need to document it. So everything will come step by step, don't worry about that. So yeah, I think that at first I'll just go according to the problems which I faced when I started studying for Mrcs, and then I can answer some questions you have for me. So I think it will save some time, because the questions you are about to ask, maybe I just already have that in my part. So if you ask for one single advice, that like what you really should do when you are still thinking about pursuing your career after graduation, so I would say that be very very sure, like 100% sure that what you really want to do. That's the best thing you can do for yourself. So I have actually seen a lot of students asking this kind of questions. Then should I go for general surgery because it's a bit easier than neurosurgery, or should I go for trauma ortho because they think that it's less competitive? So I honestly, I do not think that that is a right way of thinking. Even not about surgery, I would say that any subject, if you love pathology, there's no point of going for medicine just because you think that you need to be in a clinical subject. And if you love surgery, there's no point of going for microbiology just because you think that that career is a bit easier than being a surgeon. So for me, I have seen my friends pursuing their career in different kind of subjects, and I have seen that every subject is difficult in its own way. And any career field will cost you, even if you decide to be a GP, you decide to not to do any post graduations, just the GP practice, but that will also cost you years of training. So the only way you can keep going all these years is to do the to be in the subject you really love. So I think that if you are studying or if you are a fresh graduate, so I think it's the best time that find some time for yourself and think really deeply that which way do you want to go on. And now when you choose a way for you, just stick to that. I mean, just don't go for one or two exams and then like no, it's difficult. So that's something you don't want to do when you are in a long way career path. So that's the one thing. And once I have already wrote in my post that I'm actually the best person to ask about if you want to make your career in surgical field and if you want to come to abroad. So what you need to do is you need to find the right person and right place where to go for the information. So the thing is, if you want to be a surgeon and you go to some seniors who is doing their career maybe not in surgery, maybe in other subjects, or maybe not the place you want to go, then maybe they know something but they don't know all the things. So they will end up giving you some wrong information which sometimes are demoralizing. So these are the things that we had to face, and a lot of friends of mine had to face in their career. So I think that it's really important that you find the right person. If you want to gynae and if you want to come to UK, then it's best for you that go for someone who has completed MRCOG or giving MRCOG. So they are the person that can help you best. Now comes to website. So I would say for my juniors that make it a habit to search through websites, because you know, the authentic websites, as in if you want to give MRCS, then say that you are not finding any helpful seniors, any helpful friends who are giving MRCS. So you don't really have to be frustrated or anything. Just there is an Royal College of Surgeons website. If you just go to that website and read it thorough, maybe you know, for first 1 or 2 times it's a bit difficult because it's a lot of information to take at one time, but if you like continue to read it, and if you go through all the small steps, then every step you will find some new challenges and you will overcome that. So for ENT, as I said, that they have a separate exam. It's not MRCS, but as I have not given that exam, so I would not say that I know much about that. But all I know is for otolaryngology they have some separate exam. So I think if you search in the Google that Royal College of Surgeons or maybe ENT career in UK, so that should some authentic websites should come up. So now when you are fixed that okay, you want to do surgery and you want to come to UK, so as in you can choose some other countries too. A lot of people ask that why did you choose UK. So the only problem is if you go to America you have to go for USMLE, and if you go to Canada they have a separate licensing exam. If you go to Australia they have AMC. But getting a surgical post is a lot more difficult there. It's not impossible. I never say that it's impossible or anything, but it seemed difficult to me. So I just went for MRCS, because here getting surgical post is still a bit easier. So yeah, plastic and reconstructive surgery is one of the specialties under surgery. So if you just give MRCS and if you come here, then you will be able to apply for training in plastic surgery, as in general surgery, vascular surgery, urology, and then trauma ortho, and neurosurgery and plastic surgery. So these are the subjects that comes under the surgical specialties. So it's the same thing if you go through the MRCS pathway. Okay, so that's the two initial things that everyone should follow, that you need to fix what you really want, and you need to find the right person to ask the questions. Also, I mean, a lot of people ask that how many years does it take. It really depends person to person. Some people will take 6 years, some people will take 10 years, but as in I always say, if you love the subjects, it doesn't matter. It can take 15 years also. It doesn't matter when you love what you are doing. So yep. So scope of neurosurgery, well, again, it's a competitive subject, and anywhere in the world surgery is one of the most competitive um, fields in career. So as in Bangladesh or outside Bangladesh, you will have to fight for your place, you will have to fight for your scopes, but it's never impossible. So after MRCS you can have a job in neurosurgery, or at least a rotational jobs. Okay, so I'll just say how does the health system or the levels work here. As in Bangladesh, we know that we have interns, and then we have HMOs, IMO, CA, and registrar and consultant. So here things are quite similar, but it's just the names are different. So okay, so here we have interns, they call FY1. So they have different levels of training, which is at first foundation year, and then core training, and then specialty training. So foundation year is like internship. There is 2 years, and they have six placements each of 4 months. So after 2 years of foundation year, they apply for CT training, which is core training. So in core training you will be if you choose surgery, then you go for surgery, and then you will be rotating 4 months each in different specialties. And after core training of 2 years, you can apply for specialty training. So that means almost the like 4 or 5 years after graduation. In the meantime, before you apply for specialty training, you have to complete MRCS. So if you give so here is the important thing. So the medical students who are still in 3rd year or 4th year, what you can do is you can target for coming to UK within 1 year or mostly 2 years after your graduation. So when you come here, you can apply for the city training. So then you will have like 1 year or 1.5 years experience from your country. So they will continue it as foundation year competence, and then you can come here and you can work here for 6 months and 1 year, and then you can go for city training. But those who are a bit more senior and are coming through MRCS pathway, you can go through specialty training. But here is the twist, is if you want to go to the core training level, or if you want to go to the specialty training level, so that requires different levels of clinical experience and academic experience and teaching experience. So what you need to know is, you need to know what their requirements are for core training or for specialty training. So you need to prepare yourself according to that. Yeah, ophthalmology has some different exam, but yeah, trauma ortho, yeah, is under the surgical specialties. Okay, well, so FCPS training, that is another popular question, that if I'm doing FCPS training here, or if I'm doing residency training here, then does it count in UK experience? Well, you know, in UK they don't count your experience by the years you have spent in any surgical specialty, but they count it according to how many procedures you have done, and which have you done the procedures totally by yourself or you have assisted them, and again how many research publications you have, how many quality improvement projects have you been in, and how much teaching experience do you have, what are your management and leadership criteria. So based upon these things, they judge your eligibility for core training or specialty training. So you can't just come here and say that, okay, I've completed 3 years of FCPS training, so now, okay, am I eligible for ST training? No, you need to have like specific documentation what you have done in those 3 years. You have to have a list of the procedures you have done, either assisting or by yourself, and then they even specify some procedures that these procedures the trainee should be able to do it by themselves confidently. So clinical procedure is not a problem for us. For us, like who come from Bangladesh, the main problem is the audit and the research, because we have most of us have zero idea about that, because we don't regularly do the audit things and academic research and paper publication and teaching. So these are some things what we like normally don't do. So I have some formats, and I'm willing to make some further videos on these things. I will not go in detail of those things now. So well, I'm just doing my job. It's not I am city equivalent, but it's not a training post. I'm still trying for the training post, so it takes a while. It depends, it takes 1-2 years to apply and then get it. And during this corona situation, so everything is stuck, so I can't get any courses done. I can't get so we are even we have stopped all the elective surgeries, so it's a bit difficult for getting all these requirements done in this time. Surgical training after PLAB route. Well, so let's go through the step 1 now. So what is PLAB, what is Mrcs, what is MRCP, what is MRCOG, which one is better, like PLAB or membership exam? It really doesn't make a difference at your level. So the thing is, if you give PLAB, you come here, you get a city equivalent post. If you give Mrcs, so for you who are still in Bangladesh, who are maybe other countries, so you need to get the GMC registration before starting anything. Documentation is not clear. Okay, so yeah, so in UK they have specific e-logbooks, ISCP logbooks. So there are specific formats how you need to document your experiences. So I will come to them later. That's not actually today's topic. I just gave a superficial overview. So yeah, so to start anything in UK, anything like even to start seeing patients, you need to have a full GMC registration. So there are a number of pathways to get that GMC registration. So there are a few countries, if you do your MBBS there, you can directly apply for GMC registration but unfortunately Bangladesh is not one of them, neither is India, Pakistan. So you need to give some other licensing exam to get your GMC registration. So be it PLAB or MRCP or Mrcs. So I would say that if you are not sure enough that which specialty do you want to go, then yeah, you can give PLAB. It takes less time than MRCP or MRCOG or even Mrcs. And but the only thing with PLAB is, for PLAB 2 you have to come to UK and stay here for 3 to 4 months and then give the exam and then go back and then do all the paperwork and then come back again. So that's a bit risky, but still it's a good way to go if you are not still decided. Because I would say that if you later on you decide that no, I need to go in GP route. So there are a lot of people who are coming here through Mrcs and then changing their pathway and going through the GP training. So then it's like it's not worth giving Mrcs or MRCP. I mean, it's still you can give it. It's just to get the GMC registration. But if you are not sure enough, then you can go for PLAB. And if you are sure enough that okay, I need to go to surgery, then I think it's worth giving Mrcs, because that MRCS is something that is essential for applying for training number in UK. So there's no point of giving PLUB and then come to UK and then again give MRCS. That's like a lot of work. That you don't need to do that really. In PLUB route, can I get surgery training easily? Well, so this is the question I'm actually talking about. So if you give PLUB, you get the Gmc registration, and then you come to UK, and then when you apply for surgical training number, you need to give MRCS anyway. So it's like spending for the same thing twice. So I don't really personally think like it's worth it, but still, as I said, it depends. It totally varies person to person. So what should you do for MRCS? Now you have decided that you want to go to surgery, now you have decided that you want to go to UK, so start for MRCS. So now that this lockdown thing is going on and a lot of students are locked down, so I think this is actually a good time to start any kind of preparation. So you know, any kind of post-graduation preparation, it's quite difficult to do when you are working, or you know, you have to go out regularly. Excuse me. So when you are sitting at home, it's more convenient for you. So I would say that go to Royal College of Surgeons website. There are 4 Royal Colleges. One is in England, one is in Edinburgh, and one is in Ireland, and one is in Glasgow. Again, it doesn't make any difference which Royal College you go for. Each one of them is the same. So just open an account there, and then they will have like a lot of information in their website, which includes how do you get the membership. So getting the membership is like giving MRCS Part A and Part B. So now you can book the exam. They have like book MRCS Part A, you can find the option, and if you just go there, you need to give all your details. So which medical have you passed from, which there is some personal details, I don't remember all of them now. So when you fill up all the things, one thing you need to do is you need to send your MBBS certificate. So you need to get your MBBS certificate attested from British Council. So if you just go to British Council and if you just say that I need to attest my MBBS certificate for MRCS, so they will be able to help you, but sometimes they are not quite helpful because a lot of like junior workers don't know how does it work. So that is just if you just they will give you an envelope. It's just you make the photocopy of your MBBS certificate of both sides, and you have to give your main copy as well. So it's just send 2 or 3 copies, so you can get it attested. It takes like roughly 1 week. So once you get your MBBS certificate attested, and then you have to book your exam. So booking the exam is the easiest when you have an international credit card. So I'd say that I used Southeast Bank credit card. So some people have international credit card, so I was a student, I didn't have any international credit card, so I used Southeast Bank. They have a virtual credit card, so it is a credit card by name, but it does act like a debit card. You need to like put the money in the account first, and then you have to use the money. So it's fine. It's you can book. The booking procedure is a lot easier if you use a credit card. Yeah. So then you have to start preparation. I'll come to after MRCS Part 1 requirements for MRCS Part 2. I'll come to that. So excuse me. So then you need to start studying once you have booked your exams. So then some question come, do I need to do any coaching or anything? Well, doing any coaching is not mandatory, but I think it's worth giving some model test for self-assessment once you have finished your preparation. So for preparation, which books to start with? honestly, I didn't start with any books. I started solving questions. So that's a lot easier, because this Mrcs part 1 or part 2, this is not really an exam to assess the depth of your knowledge. I mean, it's just you have to understand that it's just to make you acknowledged with their system. So they want you to understand in which way they work, they see patients, they manage patients. So there is some specific pathway. So as in part A, there will be two sections, paper 1 and paper 2. So paper 1 is about basic science, it's anatomy, physiology, pathology, and paper 2 is all about surgery. So there is pediatric surgery, neurosurgery, orthopedic surgery, vascular surgery, general surgery, and so on, and then preoperative care, intraoperative complications, postoperative care, and then surgical techniques. So okay, so for anatomy, I would say that just read the questions, as in I'll just give some examples of their questions. So as in if you go to abdomen, they will talk about transpyloric plane, and then so the transpyloric plane is like the L1 level, and there is like 10 to 11 structures lying at that plane. So they will want to ask you that if someone is stabbed at the transpyloric level, so what will be the first organ to be injured. So then you need to know all the structures which lies at the L1 level, and then you need to know that which structure is most superficial to them. So they will make a long story that okay, a patient, you are the surgical SHO on call on night duty, so a patient came in with some stab injury on the transpyloric level. So on examination you find this. So and then they will make a big scenario, and then at the end they will just end up asking that what do you think the most commonly organ to be injured in this injury. So that's one thing. And then they have specific, if you just go on solving the questions, you eventually you will find out that they have some specific points of interest, like as in head, they have this dural vena sinus, the cranial nerves, and then the as in the pituitary gland, and then in face they have the parotid gland, submandibular gland, like the most common topics. And once you understand that okay, these are the main topics, like in parotid gland we have facial nerve, we have retromandibular vein, we have external carotid artery, and we have auriculotemporal nerve. So which one is the most superficial, which one is the deepest, so which one is most likely to be injured. So actually it does make a lot more sense if you start to read them, because as a junior doctor in NHS you will mostly have to cover the ENT when you are on night shift. So people will not come with some elective thyroid cancer or long-standing goiter during the night shift. So people will come like some RTA followed by some glass or some stab injury to the parotid gland. So what you need to know is okay, what's there. So most superficial, so okay, facial vein is there, or facial nerve is going through the parotid gland. So what you need to know is this man has been stabbed in the parotid gland, and then there is a chance that the facial nerve is injured, and you need to know how to examine the facial nerve so that you be able to call the consultant and tell them that I think the facial nerve is injured because I did this examination and I found this. So that's all the thing they want from you. As in if someone comes with some injury to neck, so all you need to know is what's there in the anterior triangle of the neck, what's there in the posterior triangle of the neck. So vein, where is the vein, so that you can be able to call you like can call the registrar and tell them that I think the vein is injured, or I think the carotid artery is injured, or I think it's just superficial. So it's important for you to know the basic anatomy, and that's all. I mean, they really don't want you to know everything about ENT or everything pediatric surgery or everything about anatomy. So I think once you yeah then again the question, MRCP or PLAB, which is the best for career in UK? It's, to be honest, it's like that chicken first or egg first, that kind of question. I mean, no one can answer this question. MRCS or PLAB, which one do you think is better choice for a fresher who had completed internship recently? Well, that fresher really needs to understand, I mean, which way does he want to go. If he or she wants to go for surgery, then I'd go for MRCS, because there's no point of giving PLAB and wasting all this time and money. So you will have to give MRCS later on anyway, and it's like the amount of expense is more or less the same. Well, coming to expense, so for part A it's like 583 or 593 pounds. Well, the good news is the rate of pound is quite lower these days, but the bad news is you really can't book any exams now. So yep, like good or bad comes with together, isn't it? Oxford Handbook of Clinical Surgery, I never read that for MRCS, I'd be honest. Is this Oxford book enough? Well, I have that book with me. After coming to UK, I bought that book, but I've never read that for MRCS. So what the exact point I'm trying to make is, you need to understand that what do they want from you, and the only way you will understand that is by solving their questions. I mean, if you start reading books, you can read books for years, but you will not understand what they are looking for you. Is there any use of MRCS in Australia? That's a good question, actually. So after MRCS, if you come to NHS and work for 1 or 2 years, then you can apply you can go to Australia with a job, but I'm not quite sure how easy it is to get a surgical post in Australia. I mean, a lot of UK graduates wants to move to Australia, but it's like they want to do it after they have completed the training here. So I guess that maybe the getting a training number in Australia isn't that easy. So, but yeah, after 2 years of NHS experience and MRCS, you don't need to go for AMC. That's the good thing. Did we need to complete any other degree after MRCS for specialist? Well, for being a specialist, really, so the word specialist is basically a vague word. So here they use the word specialist in different levels. So the ones who are ST3 register, who is essentially who has completed only MRCS and who is in the training pathway, they are called the specialist registrars. And there are some senior registrars who have been working for a long time in NHS and who have completed FRCS, but for some reason they didn't go to the through the CCT pathway for being a consultant. They are called the associate specialist. So yeah, the specialist term is really confusing. What books have I studied for MRCS Part A? That's the point I'm trying to make for last 15 minutes, that don't go for books, don't go to increase your knowledge, but rather than try to catch the tricks. Yeah, just solve the questions. So solve as many questions as you have. So here I actually have some suggestions for you. So pass test and EMRCS, I solved both, and they have 3000 questions altogether. So in that 3000, well, they actually have 2000 questions, because I think 1000 question is like just the repeat. So if you start solving questions after 50 to 60 questions, you will end up having a lot of repeated questions. So if you solve pass test and EMRCS, both of them, so you will have a total idea about how this system, how this thing is working. as in when for example, if you are reading upper GI and colorectal, you will see that all the questions they have is about upper GI bleed. So a patient is coming in with upper GI bleed. What do you need to do? What artery do you think is bleeding? So if a patient is coming with colorectal cancer, so what do you need to, so if the cancer is at this level, so what do you need to do? Do you need to do a CT scan first, or do you need to do surgery first, or what surgery should you go for? So this kind of questions, I mean, only the really common ones. I mean, there will be no like deep questions about the surgical techniques or anything like really special. They will be like, just okay, the growth is in right colon, so what do you think? And it's like with no metastasis, so what do you think we should do? So you will have to say that we need to do a staging CT scan of chest, abdomen and pelvis. And if they already mention in the question that okay, we have done CT scan chest, abdomen, pelvis, and those are clear, then you need to go for right hemicolectomy. So these things you will just understand by yourselves once you if you go to solve pediatric surgery. So you will find out mostly 8 or 10 diagnoses, like intersusception, gastroschisis, and then I don't remember all of them. I have almost forgot pediatric surgery, but all over they have like 8 to 10 cases that you need to diagnose when you see some pediatric patient in any, and that's all. Can I give during MRCS during my internship? Well, I wouldn't give MRCS during my internship. So as I said, that for giving MRCS Part A, you only need your MBBS certificate. You don't need your internship certificate. So I think that it can be given, but I'm not 100% sure. And but during internship, I would say that work on your portfolio as much as you can and gather as much clinical, because you know, in internship this is the only time you are like completely, you are totally fresher, your receptors are like too young that it can receive any knowledge it that comes in its way, and you are like the consultants, the registrar, all of them are like really eager to teach you. So I'd say that take advantage of this period, just do things, go do procedures, and do some go to the consultant and say that I need to do some research, I need to do some audits. So they will cause you know, these are the consultants from your own medical college, so basically you get a lot of help from them. So I'd say that take full advantage of your internship period. Don't go for MRCS Part A, it's just not worth it. But yeah, after internship you can give MRCS within 2 to 3 months after completion of, okay. So after this was like rough outline how you need to prepare for MRCS Part A. So after MRCS Part A, then what? So you need to go for MRCS Part B, and yeah, you don't require any training or anything before MRCS Part B, but I would say that because MRCS Part B is totally clinical, it's like the OSCE stations. So if you do 6 months or 1 year of clinical training in the meantime, so I think that will be really helpful, because in MRCS Part B you have to directly deal with patients. So if you are confident enough dealing with patients and doing some small procedures and history and examination, so it will be a lot easier for you to prepare for MRCS Part B. So MRCS Part B is the same process. You just go to your RCS account, you just book the MRCS Part B exam. You need your MRCS Part A certificate to book the MRCS Part B exam, and then it costs £953. So then when you start preparing, so MRCS Part B is 90 minutes. Sorry, no, that's the wrong information. It's 5 hours, I think. Well, maybe I'm a bit confused. So there are 18 stations in total. 18 stations, each for 10 minutes, so 180 minutes. Yep, so 3 hours. So in 18 stations, you have 10 stations and 8 stations. 8 stations for basic. Well, there will be 3 stations of anatomy and 3 of critical care and 2 of pathology. And then 10 stations will be skill stations. There will be 4 examination stations, 2 history taking stations, 2 communication stations, and 2 surgical skill stations. So for this part, the the study is a lot less than the part A, but here you need to practice. So it's good if you have some partner. So there are excellent notes, Turkey notes, Sing notes, compilation of, and there is a book, Parchment Smith. So these are compilation of based on past examinations. So these are very brief and very clear cut question answer stations. So it's like, I'll just give you an outline. For say history taking examination, they will just give you a patient with what, say urology, like benign prostatic hyperplasia. So they will come to you and they will complain urinary retention, difficulty in pass urine. So you need to have a specific format of history taking. So you have only 6 minutes to take the full history and present it to the examiner, and then they will do some cross questioning. So it's totally in 10 minutes. So you need to be very precise about your questions, that okay, when did it start, how long has it been going for, so is it like, do you dribble, do you have any lower urinary tract, well, you can't ask that. If you have lower urinary tract symptoms, you have to ask that, do you have any hesitancy, frequency, any blood in your urine. And then, like, there is a specific format. We will be posting some videos on these stations, because I think that they are not quite available everywhere. So we will help you with these stations once you start. So okay, so you will have to be very precise. In 5 minutes you need to take the full history and then present it. So you need to practice it very well, otherwise it's really, because in exam time it's really stressful, and it's difficult to organize all the things and tell it within 30 to 40 seconds. So when you tell it, and then the examiner will ask you, so what is your provisional diagnosis, and then you will be like, okay, benign prostatic hyperplasia, or bladder cancer, or whatever your provisional diagnosis is. And then they will ask that, what are your differentials. So then you will say that, okay, my differentials is this. You have to give them at least 5 to 6 differentials. And then they will ask you, so which investigations do you want to do. Then you will be saying that, okay, and then they will ask that, how do you want to manage this patient. So the point I'm trying to make is, the questions are so straightforward, you just cannot miss them. I mean, there's no way they will not try to push you, or they will not try to ask any questions. So they have also a specific question sheet, so they can't go outside them. So this is a great advantage for you. So you know that what are the questions they are gonna ask. So, and also they only include very common cases here. So it will be easy if you practice well, and it will be really difficult if you don't. So it's totally up to you. Yeah, and the next step is language test. Well, so after passing Mrcs part B, you need to give a language test. It can be Ielts, or it can be OET. So if you give Ielts, you need to obtain 7.5 in each module, and if you give OET, you have to score B in each module. So there are 4 modules: listening, reading, speaking, and writing. About the writing, again, who are I'm speaking to the students, or so I think I've seen Bangladeshi students, or I have gone through this myself. So if you just ask that which parts of this whole process was most difficult for you, I'll be like, okay, in Mrcs part B, so the communication station is really difficult for us, because we are not used to counsel patients like that, in a detailed way. Sometimes because you know, they use the actors in MRCS Part B, so they are really agitated. They will like push you to your limit, and they will be really difficult to handle with, because that's what they are trained to be. So we are not that what can I say, used to handling this patient. So this is one challenge for us. And in language test, the writing, it's a big challenge. So I'd say that if you are a student, just work on your writing. Write anything, like any review, any book you read, any review. You can practice with the IELTS book also. Just try to add more vocabularies, try to work on your grammar, on your tense, on your voice, because these are really basic things of English grammar, which we all have like learned in school life and then somehow forgot. I mean, most of us, I'm not talking about all of us. So I struggled at some point that you know, when you are giving the language test, like every silly grammatical mistake matters. So try to build up a habit of writing in English, and try to avoid the common words. Try to use the less you know, used words in your essay or review or whatever. And also try to work on your grammar, tense, voice. So for OET, there are some websites. One of them is Benchmark. Benchmark is really reliable. So if you start writing, if you subscribe in Benchmark, they will give you some writing materials. So if you just write and send them, so they will score it for you. So if you get B in their markings, then the chance is greater that you will get B in the real exam also. So yeah, that's what I would advise, that start working on your writing now. And one of the ways to improve your writing is, I think, reading. So those who have more time to prepare, I'd say that read a lot more, because then you will end up enriching your vocabulary, your way of writing. So we did not have so much time, so we just needed to do it very precisely. So that's about OET. For OET, the expense is 35 to 40,000 Bangladeshi taka. So after MRCS part A, after part B, and OET or IELTS, whichever you give. So in IELTS, there are two different categories. There is general IELTS and there is academic IELTS. So this is a great confusion. I mean, and there is UKVI IELTS. So which is for what? General IELTS, it's not for us. So let's forget about that. Between academic and UKVI, UKVI IELTS is just academic IELTS with some more CCTV, literally. I mean, the security system are more you know, it's more supervised. So when you apply for UK visa, you need to give UKVI IELTS for Tier 2 visa. So but for UKVI IELTS, to get the UK visa, you just need to score 4.5. You don't need to score 7.5. So I would say that if you are confident enough that if you sit for IELTS, you can score 7.5 or more in each module, then you can go only for UKVI IELTS. In that way, you just do everything in one expense. But if you are not, then just go for OET first, and then ensure your GMC registration, and then go for UKVI IELTS, because then IELTS score is not your problem. Okay. After MRCS part 1, is there any timeline for completing MRCS part 2? You can give MRCS part B highest 4 times in 7 years after passing part 1. If you cannot pass MRCS part B even after 4 attempts within 7 years of your part 1, then you have to give the part 1 again. But the thing is, you will not need so many attempts. I mean, it's trust me, it's quite a straightforward exam. Like if you practice You can like put your money on it. You are not going to fail, really. Even after MRCS, does everyone get surgical training post? Okay, yeah. So that's the thing actually. So the interesting thing is, now you have done MRCS and now you have done everything and you have come to UK and you feel like, okay, I'm in surgery now. So now you have to apply for the national training number, and they have specific criteria. They want you to be a total package, not only being a surgeon but being a total doctor skills. So here I think I really appreciate this thing, cause sometimes you can feel like, why do they need to have management and leadership skill to be a surgeon? So that's the point. I mean, in our country we tend to complain that, okay, doctors are not good leaders, they are not very vocal about their rights and their, so this is not an issue here. I mean, here like they have amazing unity, and even if some doctor feels like there is something wrong is being done to him or her, he will just straight away go to the authority and speak about it. So the management and leadership, it does look like, when you have to add it in the portfolio, then you may feel like, why do I need to do this? But then that's the thing we are complaining in our country. I mean, why doctors are not good leaders? So doctors need to be good leaders. So yeah, that's the thing. And also doctors need to be academic. Like I'd say that, how many medical colleges in Bangladesh have this practice of this teaching the juniors? So the one thing I really learned here, so here the consultant will teach the registrar will teach the mid-levels, the mid-levels will teach the interns will teach the medical students. And I think that's a really, really good thing to do. I mean, if the consultants is teaching the medical students, I mean, there is a big gap in the knowledge and experience. So sometimes it's difficult for us to take the things, like as a medical student, sometimes it's difficult for us to receive the knowledge from a consultant. It's rather easier if we learn that from our immediate seniors. So I think you will also agree with that. So yeah, I will send some format of teaching feedback forms. So what you can do is, like, whatever level you are at, maybe you are an intern, maybe you are a student, maybe you are an mid-level, maybe you are a registrar, so you can teach your immediate juniors. You don't even need 20 of them. Just grab 5 of them and just sit somewhere and teach them anything, like literally anything. Teach them ATLS procedure, teach them a basic suturing skill, teach them how to diagnose colorectal cancer and what's the management protocol of colorectal cancer. Just teach them how to take a proper history, what is the format of taking history, or maybe teach them the management of pancreatitis, and give them the feedback forms. And just keep that, when you get the feedback forms, just scan it and like save it in some file, and then that's done. I mean, you can submit that thing as an evidence that, okay, I like did some teaching. So that's the thing. I mean, that's something I really think that we need to start practicing in Bangladesh. So it should be the immediate senior level teaching the immediate junior one. I mean, it's sometimes I always felt like this as a medical student. I mean, I barely understood anything the consultant said. I mean, it's like over my head. I think we are almost there. I mean, the time's up. So the portfolio thing, I'll just go very briefly, because it's a very large topic to discuss with. We really need another session for that. So for portfolio thing, when you start working here, so there are 4 to 5 different like sectors where they judge you. One is definitely your clinical knowledge. Clinical knowledge means how well can you diagnose an acute surgical emergency, or how can you present the case to your senior, or how can you take some decision in emergency. So it's mostly the ward and emergency based knowledge. It's about your clinical judgment and managing the surgical emergencies. Number two is how are you in your technical skills. So if you are applying for city post, you don't really need that much technical skill. It's just closing the skin, doing some abscess, assisting some appendicectomy, being able to do some laparoscopic ports, and that's all. And then if you are applying for ST3 post, well, then they expect you to be confident with laparoscopic appendicectomy, first degree abdominal wall hernias, groin exploration, and abscess. So this kind of things they expect you to do confidently, and then the major procedures the consultants will be teaching you anyways. So it's not like you need to know the hemicolectomy to be a ST3 trainee here. So yep. Then comes the academic sector. So you need to, so audit, what does audit mean? So it's basically if you feel like something is going on around you which is not ideal, and you want to make it ideal, so you can do an audit, and then you can like you can propose the change that you want to make, and then you can do a second cycle of audit, and if the change is made, then it's a like quality improvement project. So it's like a lot of difficult thing. I don't even understand it properly because I have no exposure in audit from my country. So the simplest way I can put it is, suppose that you are a mid-level doctor in your hospital, and you feel like your interns cannot prescribe the fluids for patients properly. They don't know which fluid to prescribe and which rate to prescribe and what to monitor when they are prescribing fluids. So what you can do is make a questionnaire of 20 questions and make it like what fluid should you give in a patient who's vomiting, what fluid should you give in a post-op patient day 1. So you can make 20 questions, you can give it to your 10 interns, and then they will give you back. So they will end up giving some wrong answer, and then if you just arrange a teaching and teach them no, this is the way you should be prescribing fluids, and then again give them the questionnaire, and then if they like make it right this time, then it means that okay, you have made some changes. And well, and there are different formats of it. It's like, say for you want to find out that when you do emergency laparoscopic cholecystectomies, how many patients of them end up getting bile leak, post-op bile leak, or open conversion. You can collect data from 60-70 patients, and you can make a total document, and you can find out that how many patients and what is the percentage of patients ending up getting post-op bile leak. So then you can make an audit. But the whole point of audit is you need to make a point. I mean, what did you even do this? You need to make a point that this is the thing I'm trying to prove, and then you can make a poster, you can present it nationally or internationally. That's the thing I understand so far. I mean, it's not that I'm a specialist of audits or anything. So yeah, then comes your research project. You need to get involved in paper publications and stuff, and you need to ask your seniors, your registrars or consultants for that. And then comes your teaching activities, and then your management and leadership. So what can you show as in your management and leadership skill? Say if you are a Shandhani president, you can show that yeah, I'm an amazing leader. I've been leading my Shandhani club for these years, and I have done this, I have done that. So you can, so if you hold a post in your medical college or in any national group, so you can show that as a, or even as if you are a mid-level doctor, so if you do the duty roster of the doctors, you can show that, okay, I do the rota coordination between my junior doctors. So that's also, that comes under management and leadership. So yep, that's all. And then you can make a total portfolio. There are different websites for portfolio. There are ISCP, e-logbook. So you need to update your what you are doing in that portfolio, but the only thing is you need to get it validated by a consultant who essentially has a GMC registration. So it's a bit difficult when you are outside UK. It's a bit difficult for you to maintain that thing, but I'd say that still the things you are doing, if you keep a documentation, you can use them later on. So even if you get it signed by your consultant, but it has to be like very precise. What are you doing and what procedures have you, like if you do laparoscopic appendicectomy, what parts of the procedure you have done by yourself? Like you have done the 10mm ports, you have done the 5mm ports, you have done the endoloop, or you have cut the appendix, or you have closed the port, or you have closed the skin. So it should be like very precisely mentioned in that thing. So yep, so I would say that whatever you are doing, wherever you are doing, just get it documented and get it signed by your senior. So yep, tell us about PLAB. I'm sorry, I really cannot help about this. I have like zero idea about PLAB. How much time do we need to prepare for MRCS Part A? So if you are like serious enough, it shouldn't take more than 5 to 6 months. It depends, it really depends, vary from person to person. So well, that's the whole thing. So I wouldn't make it more longer. So I think I could answer the basic questions you had. We can, if you have more questions, but I'm repeating again, I'm sorry if I did not answer about PLAB, MRCOG, MRCP, AMC, USMLE. I really do not have much idea, and I really don't like talking about things I don't know about. So yep, thank you Tarek Kamal, and thank you Elite Medical Forum for letting me come to this platform and get connected to you guys. And I'd say that just well, pay scale, I think that's a good thing to discuss, because all the exams, I know this fees, these expenses are quite a bit for when you are a student or you are a junior doctor in I do understand that. When you complete this, if you apply for an NHS job, it depends upon your level. You can get a job in F1 level, or you can get a job in CT level. So you can like expect for salary per month 3,000 pounds, 3,000 to 3,500. It like depends on the trust and depends on your experience. But and then when you come here, once you get used to the system they work, you can do extra shifts. So basically the extra locum shifts pay a lot more than the normal salary. It's like even more than twice. So yep, that's the outcome you can expect after you have done your MRCS. Well, about the Part B centers, we don't have any centers in Bangladesh till now. So they have centers in India, Malaysia, Singapore, Sri Lanka, UK. So I appeared my exam in Malaysia, Kuala Lumpur stations. 3 years experience back home. Yeah, so as I said, it doesn't really depends how many years you have worked. It depends that what work you can done. Like if you can do laparoscopic appendicectomy, if you can do hernia, if you can do perianal abscess cases and inguinal hernia, this kind of procedures, if you can do confidently, then you can go for a ST3 post. So you know, that's. But if you think that you are not that confident about these procedures, then I would say that go for a CT post first and get used to the system, and then you can you know, apply for a higher post. Can anyone take family with? Well, if you get a job they will give you a certificate of sponsorship. With that you can apply for tier 2 visa, and your family, that means your spouse and your children, they can apply for tier 2 dependent visa. But for parents, it's not, you cannot apply for dependent visa. So yep, that's all for today. We will be making, yeah. So I want to thank Tarek Kamal, and I want to thank Elite Medical Forum, and I want to thank Genesis, and I want to thank all of you guys to join with me. Just if you have any more questions, just drop in the comment box. We will make a live session next weekend again. Until then, just stay safe, stay home, take care, and start studying. What can I say? Bye bye.